The topic of today's lecture is support for the distal extension partial denture. We will discuss the altered cast procedure, when it is used and the technique for performing the procedure. The altered cast procedure is a functional impression technique to provide intimate contact between the acrylic base and the edentulous distal extension partial denture. It is normally performed only in the mandible, although it may be performed on the maxillary partial in certain rare instances. When correctly performed, the procedure increases stability of the partial denture and reduces rotation of the partial denture about the fulcrum line.
The tooth-borne partial relies on abutment support, with minimal support from the residual ridge. Unlike the tooth-borne partial, the distal extension denture does not have total tooth support. It is dependent on the residual ridge. Movement of the partial denture is inevitable. Support is obtained with widely spaced rests, broad tissue coverage, rigid components and indirect retention.
A combination of factors influences the support provided by the residual ridge. Several of these factors are listed. These factors may be controlled by the dentist to varying degrees. Ideally, the ridge would consist of a broad rounded crest, high vertical walls, cortical bone and dense fibrous tissue. This is not often the case.
The buccal shelf, consisting of cortical bone, along with the retromolar pad, are considered primary supporting elements of the distal extension RPD. Slopes of the ridges must be used to resist lateral forces.
The broader the base coverage, the better the load is distributed. This is referred to as the snowshoe effect. The arch may be considered as having two forms. It has an anatomic form, that is, in its resting state. The other is its functional form, that is a registration, as it would appear in function. In practice, the anatomic impression used to fabricate the framework may be different from the functional form depending on the resilience of the tissues, structure of the ridge, and loading applied. In other cases, it is very important to consider that the functional form may, for practical purposes, be equivalent to the anatomic form. As a result, sound judgment should be applied when deciding to use the altered cast procedure. Your Geltrate irreversible hydrocolloid anatomic impression records the anatomic form of the arch. This is used to fabricate the framework. Tissue of the edentulous ridge may be recorded with a functional border molding technique very similar to the complete denture. Framework design is an important consideration. Support from the ridge increases with the length of the span. The illustration shows the influence of mesial rest placement on the force distribution across the length of the ridge. In addition, rigidity of the components is essential for force distribution. Some rotation of the distal extension partial denture is inevitable under functional loading. The greatest movement takes place at the most posterior extent of the denture base. Therefore, inclusion of the retromolar pad will assist in support of the partial denture. Placement of the rest anteriorly will distribute stress more effectively.
To optimize stability of the RPD, the partial denture framework must accurately fit the arch, and have a tripod of vertical support from the rests.
The total occlusal load applied is influenced by the number of teeth, the width of the occlusal surfaces, and their occlusal efficiency. Thus, less loading is applied with an opposing denture, fewer teeth, narrower table width, and anatomic tooth forms. It should be noted that these modifications are not always desirable or practical.
How does one determine when to employ the altered cast impression? To test the need for an altered cast impression, one should first fit the framework. Then, importantly, one should attach a light-cured base onto the edentulous denture base retentive element, and reseat the partial denture. When accurately seated, press down on the most posterior aspect of the denture base. If the partial denture rotates about the fulcrum line, then an altered cast impression should be considered.
Correct application of this technique will prevent rocking in mouth after the definitive base is placed during processing of the partial denture. Accomplishment of this procedure also allows one to refine the borders of the denture, if necessary.
The procedure is as follows. If one desires to use a sprinkle base, one should outline the bearing area with red rope wax, and block out space under the latter. It is recommended to use light curing, because it is more efficient, and the cure is reasonably complete very quickly. Wax blockout is not necessary, because the triad does not flow well. Ensure that the retentive elements are engaged.
After placement of the trial base, test the partial denture for rocking. If there is no rocking, proceed with jaw relation record. If the partial denture rocks, relieve the tissue side of the trial base, border mold, and use rubber base or PVS to make a functional impression with the trial base serving as a tray. The impression is open mouth. The patient moves the tongue from side to side and opens and closes. Gently hand manipulate the cheeks. It is necessary to maintain the tripod of rests in place during this procedure. Remove all excess impression material. Remember, wherever there is impression material, there will be acrylic when it is processed. Remove all impression material from underneath rests and around clasps and proximal plates. Impression material should remain only on the proposed base area. Replace the impression in the mouth. Ensure that the partial no longer rocks. Next, take the framework master cast, and cut the edentulous areas out of the cast, as seen in the figure. Secure the framework and impression to the cast with sticky wax. Make sure it is seated correctly. Box the impression. Pour the new cast. Remove the impression and base. Fabricate a new record base, test for rocking in the patient. Assuming this has been done correctly, you are ready to make a jaw relation record, and mount the master cast for setting teeth.
Review the rationale and criteria to employ the altered cast impression.